on dietary choice. We welcome you to join a part of this movement. With a small introduction, I request Dr. Sindhura, ma'am, paper.
Yeah, thank you, Dr. Suleiman. So good evening, everyone. So today we'll be talking about a study which talks about the relationship between plant-based diet and the management of type 2 diabetes. So first, we need to understand, before we talk about the study, first we need to understand the depth or the current problem of the diabetes. So let me take you through that first. So diabetes is one of the largest global health emergencies of the century, ranking among the leading causes of mortality, together with cardiovascular disease, respiratory diseases, and cancer. According to World Health Organization, non-communicable diseases accounted for 74% of deaths globally in 2019, of which diabetes resulted in 1.6 million deaths, thus becoming the ninth leading cause of death globally. The diabetes burden is high and increasing globally, and in developing economies like India, mainly fueled by the increasing prevalence of overweight or obesity and unhealthy lifestyles. So if we look at the global diabetes facts or the statistics of the diabetes globally, according to the International Diabetes Federation Diabetes Atlas 2021 reports, 540 million people have diabetes globally, which is around 10.5% of the adult population in the range of 20 to 79 years age group has diabetes. And by 2045, they are expecting it to be approximately 783 million people will be having diabetes, which is an approximate increase of 46%. Currently, 1 in 11 adults are living with diabetes, which is going to be like 1 in 8 adults by 2045. And 240 million people are living with undiagnosed diabetes right now globally. And 3 in 4 adults with diabetes live in low and middle income countries. And 90% of diabetic cases belong to the type 2 diabetic category. And if you look at this report from the IDF Diabetes Atlas 2021, specifically in the Southeast Asia, they're expecting almost a 68% increase by 2045. And when it comes to the statistics of the diabetes pertaining to India, according to the recent ICMR INDAB study, the new national estimates in 2021, there are more than 1.1 million people with diabetes, which is approximately 11.4% of the nation's population, which is almost a whopping 44% increase in diabetic cases over a period of just 4 years. And the study also showed that around 136 million individuals, which is approximately 15.3% of the Indian population, were identified as having prediabetes. If you look at the different states of India, the highest prevalence is among the following 3 states, that is Goa, Puducherry, and Kerala, with the prevalence rates of 26.4%, 26.3%, and 25.5% respectively. If you look at the stats of India, like 1 in 11 adults have diabetes, and India accounts of all the diabetic population in the world, India accounts for 1 in 7 of all the adults. And diabetes is responsible for approximately more than 7.5 lakhs deaths in 2021. And total diabetes related expenditure in the region amounts to almost $1,000 billion US, which is and 1 in 4 live births are affected by hyperglycemia in pregnancy. And if you also look at our India, almost majority of the states have more than 10% prevalence rate. And here, this particular gray area, the prevalence has not been estimated in that specific area. Now, if you look at the diabetes prevalence, like state-wise, and specifically, if you compare the urban and rural population, definitely majority of the urban populations, like all the urban populations, have more than 10% of the diabetes prevalence compared to rural. And if you look at the state-wise, definitely Maharashtra, Goa, Karnataka, Kerala, Tamil Nadu, Puducherry, Odisha, West Bengal, and Himachal Pradesh, Uttarakhand, Punjab, Chandigarh definitely are having more than 10% of the prevalence diabetic rate. When it comes to pre-diabetes, it's like we can say almost like a 50-50 here in the urban, it could be, or the rural. And pre-diabetes, we can see more than 15% prevalence rate of pre-diabetes is in the northern states compared to the southern part of the India. In the southern part of the India, we can see approximately like somewhere in between 10 to 15%, except Kerala and Puducherry and Goa. Now, when we look at the type 2 diabetes risk factors, the major risk factors are the changes in diet and physical activity. That is, unhealthy diet and physical inactivity are related to the rapid development and urbanization that have led to sharp increase in the numbers of people living with type 2 diabetes. So definitely the unhealthy dietary patterns are contributing to a major burden of type 2 diabetes, and hence this is the reason why we are stressing, or we are doing this particular study, that what kind of a dietary pattern helps in better management or better control of type 2 diabetes, which is the need of the hour. If you look at the impact of diabetes, like if we don't manage the diabetic condition properly, it can lead to multiple health complications like diabetic eye disease. It is going to affect the oral health. It is also going to cause the complications in the pregnancy, and it's also going to cause the cardiovascular diseases, kidney diseases, and nervous and vascular complications as well. So diabetes has the potential to have a huge impact on individuals' physical and psychological well-being as well. So IDF estimates that all-cause mortality globally attributed to diabetes is around 14.5%, and the highest number of deaths associated with diabetes are the ones with highest numbers of diabetic countries like China, India, Russia, and USA. And depression is 3 times most common among the people with diabetes, and it's also associated with poor glycemic control. So based on the facts discussed, diabetes management is of utmost importance for better quality of life, and dietary habits plays a pivotal role in the management of diabetes. When we look at the diabetes management and dietary interventions, the American College of Endocrinology in their new guidelines suggested that plant-based diet is the optimal nutrition plan for people with diabetes, as it promotes the well-being and better management of diabetes. According to IDF report, lifestyle behavior commonly associated with poor diet, like processed meats and high fat content foods, is the most influential factor for development of diabetes. WHO also stresses on promoting interventions that support healthy diets for a consistent management approach of type 2 diabetes. And the EPIC Interact study, which has shown a higher risk of type 2 diabetes among individuals with high meat consumption, specifically red meat and processed meat. After controlling other risk factors for type 2 diabetes like smoking, physical inactivity, alcohol intake, etc., also, the association between meat consumption and incidence of type 2 diabetes remains significantly high. So which emphasizes the importance of healthy diet behavior in management of type 2 diabetes. In this particular study, they have referred to the plant-based diet. That means what they are exactly referring to is to avoid the consumption of most or all of the animal products and high consumption of fruits, vegetables, legumes, nuts, seeds, whole grains. And according to this particular systematic review, a plant-based dietary pattern seems to offer high protection against development of diabetes because the plant-based diets are rich in antioxidants, dietary fiber, micronutrients, and unsaturated fatty acids, which are considered to act as protective factors against diabetes. And plant-based diets are associated with significantly lower risk of diabetes and also with improved HbA1c levels. A better behavioral approach can promote effective management of diabetes, which can result in better glycemic control and psychological well-being. So the study that we are dealing today is effectiveness of plant-based diets in promoting well-being in the management of type 2 diabetes. Is a systematic review which has been published in the year 2018, and the authors are Anastasios, Trice, and Izara. And the aim of this particular systematic review is to systematically analyze the available literature on plant-based diet interventions targeting and or including adults with diabetes, and to clearly define the benefits on well-being of such interventions. So the further details of this particular study will be taken over by my colleagues. Deshna, you can please take over. Thank you so much.
Hello?
Yes.
Can you hear me now?
Yes, Deshna, you're audible.
Good evening. Good evening, everyone. Today, now I am Ms. Deeshna Oswal. I am a PhD scholar in public health nutrition, and I am gonna go with methodology part of this particular study. So, as we know, methodology of any study is the heart of the study. So, next slide, please. Yeah. So the inclusion criteria for this particular study was plant-based diet intervention targeting or including adults with type 2 diabetes. Age of the participant being greater than or equal to 18 years. And those studies which clearly defined health outcomes were included. Controlled trials with length of greater than 3 weeks were included. But the exclusion criteria for this particular study was any dietary intervention for diabetes other than type 2. Duplicate studies were excluded. Age of the participants being less than 18 years and uncontrolled studies were excluded along with diet intervention more than 10%. Next slide, please. Search strategy is for systematic review. So they systematically searched article from 10th November 2017. Databases used were Allied and Complementary Medicine, Cochrane Central Register of Control Trials, Cumulative Index of Nursing and Allied Health Literature, e-journals, Exopta Medica Database, Medline, Health Consortium, Psych Articles, Psych Info, PubMed, and Social. Search terms specifically they used, these were the mesh terms, that is medical subject headings used were plant-based or plant-based. So these were the mesh terms they used. Second was diabetes, third was intervention or control trial or randomized control trial or randomized control trial. Next slide. Data extraction. After searching for the articles from these particular databases, they extracted data from the studies related to quality of life, self-esteem, depression, perceived pain and neuropathy symptoms, food conductance, nutrition efficacy and general efficacy, dietary adherence, dietary restraint, dietary disinhibition, and diet acceptability. They also included weight, HbA1c, fasting blood glucose, total cholesterol, LDL cholesterol, triglycerides, diabetes-related medication. Along with that, finally, they included what was the sample size of that particular study, the mean age of the participants, gender, design, and duration. Next slide, please. After extracting the data, they screened the data and using some quality measures, and they also used some quality measures. They screened for whether the article could be included and was according to the inclusion criteria. Duplicates were removed. Relevant studies were screened using the title, abstract, and full text of the article. Now, for quality, to check the quality of the article, they used EPHPP scale, which is a scale which actually scores the article and on the basis of some 6 characteristics into it can be either weak article, it can be either moderate or strong article. So EPHPP rates article as strong, moderate, or weak. This particular systematic review excluded poor rated studies. Next slide, please. Thank you so much. Now I would like to ask Nitesh sir and Suleiman to continue with the results. Suleiman and Abhishek sir to continue. Thank you.
Good evening, everyone. Am I audible?
Yeah, Suleiman sir, you are audible.
Thank you. So me and Dr. Abhishek will be speaking about the results for this journal club today. So next slide, ma'am. A computerized systematic search was performed using electronic databases as mentioned earlier, and specific search terms were used to locate and finalize studies. Using this, 1,240 articles were finalized, And after screening and full text assessment, they came down to 11 articles. The reason for few articles being considered, they've mentioned in the paper, as dietary interventions were difficult for a large number of individuals to follow up. And that's why the patterns, hence the number of articles were reduced to 11. Next slide. I'll discuss about how the articles came down to the number. So initially, the number of total articles identified was 1,240, and after removing duplicates, it came down to 516 articles. And based on the title, few were filtered to another 475 were filtered on that basis. And few studies included non-plant-based diets, since the studies focusing entirely on plant-based diets and management of type 2 diabetes. The studies which included non-plant-based interventions were also excluded from this. And since type 2 diabetes can be measured using HbA1c levels, the studies which did not provide either baseline or endline or both of the HbA1c levels were also excluded. And post full text assessment, the articles reduced were to 11. Study characteristics that were done in the study is the included studies were in the range from 1999 to 2017, and the total sample size, which is including the sum of individuals from all the studies that met the inclusion criteria, was 433 with a mean sample size of 48 per study. And the intervention group had 219 while the control group had 213 participants, which means a fair amount of individuals were on both sides. Age of the participants was between 27 and 80 years, which is quite a long range, and it thus can be a confounding factor to the result. And withdrawal rates were also mentioned between 3.5 and 29%, which means that a minority of people did withdraw from the study being done, but then they were not considered in the results. And trial duration was between 3 and 74 weeks, which is quite well above the minimum 2 months required for a study to be done. Further, moving to a few more characteristics of the study, the types of studies included were randomized and non-randomized controlled trials. 7 were randomized controlled trials out of the 11, of which 4 of them mentioned the randomization process. 8 of the studies examined vegan diets in the intervention group, while 1 examined vegetarian diet, which was plant-based. And HbA1c was mentioned either as the primary or secondary outcome, and it was mentioned both in the baseline and the endline values. Therefore, it provided a non-subjective evidence to the intervention. Trials provided previous slide. Trials provided nutritional education, so there were medical doctors, registered dietitians who deliver the dietary intervention, because this is well required, because since in the public's interest, it's not likely that everyone will have knowledge about how to go about with a plant-based diet. So proper information was passed on to the participants. And moving to the findings of the study, we'll discuss on the 4 topics: quality of life, psychological and social well-being, adherence, acceptability and diet behavior, HbA1c and diabetes control, and further medical outcomes which can be seen. First, speaking about the quality of life, psychological and social well-being. There was overall an improvement in the psychological and physical components, and there was significant difference observed between the intervention group and the control group. Depression levels dropped in the intervention group, and there was significant difference in self-esteem, nutritional efficacy, and general efficacy. Changes in perceived and pain and neuropathy symptoms were also observed. A significant decline in foot conductance was reported in control group, suggesting that the intervention might have stopped or slowed down the progress of nerve impairment, which is seen in diabetic neuropathy. And electrochemical skin conductance, which measures sweat glands, which is dependent on proper sympathetic innervation. And electrochemical skin conductance decreases as peripheral neuropathy progresses in type 2 diabetes. Therefore, an increase in electrochemical skin conductance was a positive indicator in the intervention group. The remaining findings, Dr. Abhishek will continue.
So before going to the findings, we should know about the study groups in each study group. This intervention group and control group. Intervention group, the study participants taken the vegetarian or vegan diet. The control group, the study participants taken mixed diet, both vegetarian and non-vegetarian. First finding, we see the quality of life, psychological and social well-being. Only 3 studies done this study. The physiological and psychological well-being is improved in the intervention group, and only physiological well-being is improved in the control group. You can see in the first study. In the second study, quality of life improved in the intervention group, and pain and neuropathy decreased in the intervention group. Food conductance and electrochemical skin conductance is a biomarker for neuropathy. It decreased in the control group, which is a bad it should increase because for improvement of the neuropathy. In the third study, quality of life improved in the intervention group, and depression is decreased in the intervention group. So overall, intervention group, the vegetarian diet people, the quality of life, social well-being, and neuropathy symptoms are improved compared to the control group. Next slide. Coming to adherence, acceptability, and diet behavior. As you can see, the studies outlined by red color. They showed the greater adherence among the participants of the intervention group compared with the control group. So they felt less constrained regarding the diet adherence. And one study shown, the study outlined in green color, it's shown that greater adherence among the participants of the control group compared with the intervention group. Only this is the only study shown this very contrast. It is different from the rest of the studies. The another study which shown in blue color, it shown higher adherence in both groups, and another study in black color outlined, it showed dietary restraint increased to a greater extent only in the control group. This signifies the control group participants showed constraint to the fixed diet given, means the greater and the adherence is low in the control group. Next slide. These are the red marker study. They shown the greater adherence in the intervention group. So overall, is a intervention group, the vegetarian taking study participants, they showed more greater adherence to the vegetarian diet compared to the control group study participants, and they feel less constrained to the fixed vegetarian diet. That's it. And HbA1c and diabetes controller. One study didn't reported HbA1c levels specifically for type 2 diabetes patients, so we didn't consider it. And the studies outlined in the green, they shown decrease of the HbA1c was greater among the participants in the intervention group compared to control group. So signifying this vegetarian diet is ideal diet for diabetics. As you can see, there are majority of the studies showing HbA1c levels are decreased in the vegetarian group. And further medical outcomes, the studies outlined in red color showed the reduction or discontinuation of the diabetes related medications among participants at the end line in the intervention group compared to the control group. And first study, 1 minute. Please go to the previous slide. First study shown two participants with type 2 diabetes in intervention group no longer meet the criteria for type 2 diagnosis at the end line. So improved prognosis of the type 2 diabetes in the intervention group. And third, as you can see, another study, 4 participants in the intervention group showed reduction in the lipid lowering medications. But in the control group, no participant showed improvement in the lipid lowering medications. So the vegetarian people, uh, their dose, their hypolipidic medications dose reduced over the time. And another study, which is mentioned in the by 2014 Italy study, five out of 7 participants in the intervention group discontinued oral hypoglycemic agents, whereas only 1 out of 7 participants discontinued in the control group. So, what we say in the vegetarian diet, people showed more improvement with regard to reduction of the diabetes medications, hypolipidic medications, and one study, first study, you can see the diabetes medicine reduction in 43% in the intervention group compared to 5% in the control group. And last, as you can, another study shown type 2 diabetes medication reduction is 35% in the intervention group, whereas 20% in the control group. And the last study is showing in the intervention group, insulin decreased in 2 participants, OHS doses decreased in 3 participants, antihypertensive medication discontinued in 2 participants, and there are no changes in the control group. So what these all studies are signifying is in intervention group, the study participants over the time their anti-diabetic, hypolipidemic, antihypertensive medications are all doses are all decreased over the time. Whereas there is minimal improvement in the control group. Okay. This one, there is significantly greater weight loss in participants in the intervention group also. One, this is discussion, right? Hello.
Yeah. Thank you, Abhishek sir. Hi everyone, I am Dr. Nitish Pasade. And to begin with, I would like to share some stats. Yeah. So, according to WHO, in India, there are around 77 million adults more than 18 years of age are suffering from type 2 diabetes, and nearly 25 million are pre-diabetics. But as earlier mentioned by Sindhura ma'am, according to latest ICMR India V17 study, prevalence of diabetes and pre-diabetes in India is much higher. According to them, there are around 101 million cases of diabetes, and 136 million people are with pre-diabetes. According to Center for Disease Control and Prevention, 1 in 5 adults with type 2 diabetes has depression, whereas 1 in 3 adults with type 2 diabetes experiences diabetes distress. According to a meta-analysis done by Noven et al., suggested that when compared with non-diabetic controls, people with type 2 diabetes have a 24% increased risk of developing depression. So now coming to our today's journal club article, today's systematic review demonstrates evidence that a plant-based diet can significantly improve physiological well-being, quality of life, and diabetes mellitus control. 3 studies included in this article report better psychological outcomes, and according to them, there was a significant improvement in depression, emotional well-being, physical well-being, and general quality of life. There was also they noticed a significant improvement of reported pain due to diabetic neuropathy among intervention group participants. Now, coming to adherence to diet, this in this review, total 8 studies reported adherence to diet, out of which 4 studies showed higher adherence in intervention group, whereas one study by Little demonstrated higher adherence in control group. This difference was most probably attributed to the fact that in this study by Little, they conducted only phone consultation, while a study with higher adherence in intervention group had conducted weekly workshops. Furthermore, one study had showed higher adherence in both groups, and this most probably due to that in this particular study, they conducted a daily daily education session, and this study was conducted under supervision. So all these findings suggest that intensity of education intervention is directly related to the adherence with diet and compliance with diet. The dietary behavior and dietary acceptability. In this article, 3 studies reported findings regarding this dietary behavior and dietary acceptability. In one study, they reported significant decrease in dietary disinhibition in intervention group, whereas dietary restraint was observed significantly increase in uh, control group. So basically, this inhibition is the tendency to overeat in response to stimuli such as emotional stress, whereas restraint is a conscious restriction of food to prevent weight gain or promote weight loss. So this greater increase in dietary restraint only in control groups suggests that control group felt more constrained by their assigned diets than plant-based diet groups. Another study suggested equal acceptance by both groups, whereas one study demonstrated significant improvement in disinhibition and restraint in intervention group. In terms now coming to outcomes, in terms of diabetes mellitus control, this review suggested that intervention group performed better than control groups. So following are the findings with regard to diabetes control and outcomes in intervention group compared with control groups. So 8 studies demonstrated better reduction in HbA1c levels. 6 studies demonstrated reduced doses or discontinuation of type 2 diabetes medication, whereas 5 studies demonstrated greater weight loss. 3 studies demonstrated reduction in fasting blood glucose levels, and furthermore, 2 studies demonstrated reduction in low density lipoprotein cholesterol, and 1 study demonstrated reduction in total cholesterol and triglyceride levels. Next slide. So now here is one chart from a study by Pan et al. That study titled as Red Meat Consumption and Risk of Type 2 Diabetes, 3 cohorts of US adults, and meta-analysis. This chart depicts change in type 2 diabetes risk from substituting miscellaneous foods from red meat. They use nuts, low-fat dairy, whole grains, poultry, and fish as a to replace red meat. In this chart, they depicted hazard ratios and 95% confidence interval for diabetes associated with the replacement of other food groups, and they adjusted that for other compounding factors. So here in this chart, we can see that the most significant results were observed where red meat was replaced with whole grains and nuts. This study also suggests that the 16 to 35% reduction in risk of forming type 2 diabetes on replacing one serving of red meat with these miscellaneous food can be achieved. Next slide, ma'am. So now I would like to highlight some recommendations from various guidelines relevant to today's topic. So according to one report by American Diabetes Association, titled as Nutritional Therapy for Adults with Diabetes and Pre-Diabetes, the Consensus Report 2019. They suggest that the reduction in HbA1c from medical nutrition therapy can be similar or even better than what would be expected with treatment using currently available medication for type 2 diabetes management. They recommend healthcare professionals that they should focus on key factors among dietary patterns, and these key factors include emphasis on non-starchy vegetables, minimizing added sugars and refined grains, and preferring whole foods over processed food to the extent possible. Nice guidelines for type 2 diabetes may let us recommend that they recommend eating high amount of fibers, low glycemic index sources of carbs like fruits, veggies, and whole grains, eating low fat dairy, eating oily fish, and minimizing intake of saturated fatty acids and trans fatty acid. Nice guidelines also recommend individualizing dietary dietary advice. Next slide. Dietary recommendations of Diabetes and Nutrition Study Group of the European Association for Study of Diabetes recommend emphasizing consumption of whole grains, whole vegetables and fruits, legumes, nuts, seeds, and non-hydrogenated and non-tropical oils. They also recommend minimizing consumption of meat, sweets, sugar, sweetened beverages, and refined grains. Now, our Indian Research Society for Study of Diabetes in India and Endocrine Society of India recommends that for protein, red meat intake should be avoided. They also, for food groups and food patterns, they recommend that diet uh, diet rich in fruits, leafy vegetable, nuts, whole grains, pulses, legumes, unsaturated fat, low fat dairy, and unprocessed food should be preferred. And they also recommend that extreme diets like low carb diet and very low carb diet must be planned and executed following consultation with physician or dietitian, and that is also for a short period. So now coming to strengths of this today's Journal Club article. It was the first review to summarize psychological outcomes of plant-based diet in type 2 diabetes. This in this article, the studies included from different countries, so which increases the likelihood of generalizability of the findings. And these studies were focused on dietary patterns instead of individual nutrients, so which makes it easier to apply findings of this study to general population. And finally, as discussed before, various guidelines support these findings. That being said, now this study also has some limitations, like this study included in this article, those studies included had a small sample sizes. Two studies were not randomized, and there was possibility of recall bias because adherence in controlled trials regarding diet is difficult to be followed and measured to by researchers, because it is highly dependent on participants' recall, and which may be inaccurate. So now coming to the conclusion of today's article, this systematic review suggests that plant-based diet, along with education intervention, can improve psychological health, quality of life, HbA1c levels, and weight loss, and which in turn leads to effective control of type 2 diabetes and its complications. These findings also suggest that the support the suggest that this intervention can lead to improve lipid profile, and which in turn reduces the risk of cardiovascular diseases. The authors of this particular article suggest need for more studies in future to establish relationship between psychological health, dietary patterns, and diabetes control. Next slide. So now finally I would like to mention that today's journal club article is work of Anastasios Tompanakis, Chris Turnbull, and Isora Alba-Barba, titled Effectiveness of Plant-Based Diet in Promoting Well-Being in the Management of Type 2 Diabetes, a Systematic Review, and which was released in BMJ Open Diabetes Research Care Journal in 2018. Thank you. And now we would like to open floor for any questions and comment.
So any questions, you can please drop them in the chat box, please. All right. I think Dr. Suleiman, you can give vote of thanks.
Yes, ma'am. Distinguished participants, members of the PAN organization and our presenters, it's a privilege to deliver the vote of thanks again on behalf of the PAN organization for this online journal club. First and foremost, I would like to express gratitude to all the participants who joined from various corners, and we appreciate a commitment to advancing knowledge in the field of nutrition. I would also extend a special thanks to the PAN team. The commitment to promoting evidence-based nutrition is commendable, and we are grateful for the unwavering support. Also like to express sincere appreciation to our distinguished presenters. Their insightful discussions and insights have undoubtedly enriched our understanding of this vital field. Lastly, I would like to take this opportunity to encourage all participants to continue their involvement in future journal club meets, webinars, CMEs, and many such events organized by the PAN organization. Thank you all, and let's meet in our next journal club next monthly journal club, which happens every month in the last week. Thank you.
Thank you so much, everyone, for joining, taking time and joining our journal club. Please keep joining in future months, in future journal clubs as well. Thank you so much, Dr. Yogita. Thank you so much, Dr. Kiran. Thank you, Dr. Nitish, Dr. Abhishek, Dr. Suleiman, and Deshna. We'll be meeting you in the next month. Take care. Bye.
Thank you.
Thank you, ma'am.
Thank you, madam.